Welcome to the TCM Teach Podcast, the business podcast designed exclusively for acupuncturists and Chinese medicine herbalists who are ready to build thriving, sustainable businesses. I'm Sabey Smith, a licensed acupuncturist, herbalist, professor, coach, entrepreneur, and I've spent years helping practitioners just like you not only master their clinical skills, but also build practices that operate with integrity, professionalism, and peace of mind. Today we're diving into a topic that every practitioner needs to take seriously: HIPAA and patient privacy compliance. I know what you're thinking. It could sound overwhelming, complicated, and more like corporate healthcare. It might not totally sound like running a healing business. However, the truth is, HIPAA isn't just about legal compliance. It's about trust. Patients need to feel confident that the sensitive information they share is safe to share with you, and making sure that it's respected. The good news? Well, HIPAA compliance doesn't have to be scary or complicated. In this episode, I'll break it down step by step so you can understand what matters most, what the risks are, and how to protect both your patients, your practice, also protect yourself too. But right before it, quick little disclaimer. Please remember, I'm simply a practitioner here to support you on your journey. The information shared in this podcast is intended for educational and learning purposes only. It should not be taken as professional, legal, or financial advice, and for specific guidance for your business, consult a licensed professional. Thank you. Granted, I'm an acupuncturist, but you get the idea. Lawyer, accountant, blah, blah, blah. So, let's get started. Why privacy matters in a healing practice. Patients share some of their most personal details with you: health history, family issues, emotional struggles, and it gets more intense from there. Protecting that information is about trust. It's about maintaining professionalism, and it's not just compliance. In TCM, healing begins with safety. We have to make sure someone's shen is calm before healing even begins. So when a patient feels safe, they open up, and the healing is obviously going to deepen. What we want to understand here is patient privacy and trust go hand in hand. Trust will create stronger healing outcomes and thus business longevity. It's going to increase your rapport with patients and keep them happy. They're going to want to support you just like you support them. So if you're even a seasoned practitioner, let's go through this episode and make sure that you are fully in compliance, making sure that you're brushed up on any new policies as well. So what HIPAA really means: it's the Health Insurance Portability and Accountability Act. The core areas that you need to know as practitioners are: 1, the privacy rule. This limits what patient information you can share. 2nd is the security rule. Sets standards for how electronic data is protected, as well as paper data, obviously. And then breach notification rule. Requires you to notify patients if their info is exposed. So here's the translation. HIPAA is about who can access patient info. And as a result, you're going to understand how it should be properly stored. And you also have to understand what happens if it's compromised. Likelihood of this happening? Hopefully quite slim. Should you know it? Yeah. Did you probably have training on it? Yeah. Do you need a reminder? Quite possible. So where practitioners do run into trouble: 1, using personal email or unencrypted text messaging for scheduling or patient updates. Maybe you weren't taught this. You're actually not supposed to use a personal email. You should have something that's encrypted, HIPAA compliant. You can look this up. You can order one specific for that. And encrypted text messaging. So there's actually different apps that you can use. You can look up to have messaging between patients that is actually HIPAA compliant. Just using your iPhone is not going to be HIPAA compliant at this time, at least. So you want to make sure your charts are stored accordingly on a computer, like an EHR system, and they're password protected. And you also want to make sure that they're backed up somewhere. Usually, most of the EHR systems now are going to be backed up to the cloud. So that way, if something crashes on your end, you're not going to lose the records. Just understand that you want to have them password protected. That's not only protecting the patient, that's protecting yourself. Make sure you don't leave paper files out in the open, and make sure that they're behind lock and key. Locking cabinets. A lot of people like the idea of paper, and then even if they transition to EHR later, they still have to hold on to the records for somewhere between 6 and 7 years. I know a lot of states it's 7 years. And then make sure talking about patients casually in public spaces does not happen. That's a big one I've noticed students need to learn. In the hallway, waiting rooms, with friends, just don't do it. It's technically not allowed. So it's someone else's privacy. Keep it that way. Using software that isn't HIPAA compliant. Oh boy. Free Zoom, Gmail, Dropbox. Those are not HIPAA compliant. There are HIPAA compliant ones available, and you can purchase them. There are free options available. All it takes is a quick little search online. Make sure you're protecting the information. So what's the key message here? Most violations are not malicious. They actually happen from a lack of awareness. So the reason I even want a seasoned practitioner to hear these things is technology updates too. So if you're using an email that's not a professional encrypted email or HIPAA compliant email, it might be time to get that instead of your regular Gmail. Make sure it's encrypted. HIPAA compliance essentials. So secure communication. Use HIPAA compliant email, telehealth, and scheduling platforms. Your EHRs are generally going to at least help you with the telehealth and scheduling platforms now. Since 2020, with COVID, a lot of telehealth kept practices alive and also helped people get their herbs or consults, whatever. Check on email. Find a HIPAA compliant email. Get business associate agreements, BAAs, with vendors. Just check and make sure that you have some type of agreement that the information is not going to be shared. Preferably make these things encrypted online. Data protection. Encrypt devices, phones, laptops, tablets. Use strong passwords and update them regularly, and back up patient records securely. Some of these things are going to be from like the EHR systems you pay for. Some of them are not. Now, I understand some of you only want to do paper because you don't want to deal with any of this. But in order to communicate with your patients, they're going to have to talk to you somehow. So make sure whatever technology does come through your office, that it is protected, encrypted, whatever it may be. Physical security, lock file cabinets for paper charts. Just make sure they lock. And make sure that you're following state guidelines. Some of the state guidelines are different. Sometimes it's locking file cabinet in a locked space. So for example, the door locks to the file room that has locked files. Limit who has access to your office and files. That should be obvious. And shred old patient records when disposal is allowed. Again, that's typically around 7 years, but you have to check each state regulations. Policies and training. Create a privacy policy for your clinic. This could go into your SOPs for employees as well. So you want to train your staff on HIPAA basics. This is to protect you, to protect your business, to protect your patients. Document your compliance steps. What are the things you've done or put in place? Again, you could put this in your standard operating procedures. What do you do, put in place to maintain HIPAA compliance? All right, the TCM lens on privacy. In TCM, we talk about the heart and the Shen. So this is the seat of trust and openness. And protecting patient privacy is like creating a calm heart space. It allows Shen to rest and patients to feel safe and heard. Just like Wei Qi protects the body from external invasion, HIPAA compliance protects your clinic from external threats like fines, lawsuits, or breaches. So the key insight here that I want you to have is compliance is not going to be fear-based, like I've said before. It's a form of care, respect, and integrity. So some of these HIPAA things like secure communication, data protection, physical security, policies and training, these are all part of things that you want to pay attention so that a HIPAA violation does not occur. Common mistakes to avoid. Thinking I'm too small for this to matter. HIPAA applies even to solo practitioners. Assuming your malpractice insurance covers HIPAA breaches. Most of the time it doesn't. Using convenience over compliance, texting patient info on personal devices, that's not a good idea. Ignoring the need for BAAs with software providers. So that, again, that's a business associate agreement, okay? Sometimes they even have you sign one automatically. Whatever technology you use, look for a BAA in place and have that. And then what else do I have here in my notes? I have create or update your privacy policy and give every patient a copy. I always had that in my initial paperwork so that they see what we're doing, putting in place to make sure that their privacy is maintained. And lock your paper files and encrypt your devices. Schedule an annual privacy audit for your clinic. Make sure everything's up to date, everything's working properly. Pretty straightforward. So what's the ripple effect of privacy protection? Patients trust you more deeply when they know their personal information is secure. Your reputation grows, trust and professionalism leads to referrals. You reduce anxiety for yourself, there's no fear of violations or fines, and compliance positions you as a CEO level practitioner. So you're not just a healer, you're a trusted healthcare provider running a professional, compliant business. So I want to leave you with this. HIPAA and patient privacy don't have to feel overwhelming. With a few simple systems in place, you can protect your practice, safeguard your patients, and strengthen the foundation of trust that your healing work depends on. So I've created a resource called the Compliance Compass, which outlines the key steps you can take right now to protect your patient's privacy and keep your clinic compliant without feeling too overwhelmed. So you'll find that in the membership. And in our next episode, we'll be diving into record keeping and documentation systems that work. So until then, thanks for tuning in to the TCM Teach Podcast, and we'll see you next time. Cheers.